Hi everyone. Today we are very grateful and very happy to online to discuss with the Renuvion, and we are very happy to welcome Apex Medical Asia Director, Sales Director Barry Rickberg. So he will start it.
Thank you, Justin, and thank you, Dr. Peng. I'd like to give a brief introduction of Dr. Peng. He is a board-certified dermatological surgeon in Taiwan. He is serving as president of the Laser and Photonics Medicine Society of Taiwan, executive director, Taiwanese Dermatological Association, and director of the Taiwanese Society for Dermatological and Aesthetic Surgery, and past president of Taiwan Society of Hair Restoration, and board director of ISDS and board director of DAZL. Very busy guy. Dr. Peng is the founder and director of Dr. Peng's Dermatological Cosmetic and Laser Clinic, the P-Scan Professional Clinic in Kaohsiung City in Taiwan. The clinic now has 9 full-time board-certified dermatologists, 1 part-time board-certified dermatologist, and 2 part-time board-certified plastic surgeons working together, and have more than 40 different kinds of lasers and energy-based devices. I've known Dr. Peng for 3 or 4 years now, had dinner with him in Barcelona before the COVID thing, and he's a delightful gentleman and a good doctor. And along with him, he has asked that Dr. Sattler help out with this workshop. Unfortunately, Dr. Sattler is not feeling well this week, and so his able colleague, Dr. Stanger, will fill in with the questions and answers. There will be a presentation from Dr. Sattler, and Dr. Stanger will help out with that. So with that, I'll turn it over to Dr. Stanger, and we'll get started. Thank you very much.
Yeah, thank you.
Thank you very much for introducing. I thought Dr. Peng wants to say some words in first.
Yeah, okay. It's my honor to chair this session to introduce my good friend, Dr. Gerhard Sattler. And I've been to visit his beautiful clinic in Germany 2 years ago, and see his procedures. He's a brilliant guy of a dermatological surgeon. He's doing the liposuction for more than 30 years and have done more than 10,000 cases by himself. And we know he's a brilliant guy for liposuction, also for body contouring. We know for body contouring, we not only need to remove the fat, we also need to tighten the tissue and the skin. So today's webinar is some introduction and experience sharing about a very nice device, Renuvion. So please welcome Dr. Gerhard Sattler.
Good afternoon, Taiwan. Good afternoon, dear Peter. Thank you for inviting me. I'm Gerhard Sattler from Germany, Rosenpark Clinic, and I will talk today about Renuvion. Let's start in order not to lose too much time. Renuvion is a wonderful new technology which is really important in the future for special aesthetic treatments, and in this early afternoon we will cover a lot of these details. And now this is a little introduction for understanding the technology. Renuvion is a system indicated for the delivery of helium plasma to cut, coagulate and ablate soft tissue. Renuvion has a central general clearance and is not cleared for any specific procedure. So Renuvion has received a general clearance as noted above and has not been determined to be safe or effective for the use of any specific procedure or for the treatment of any specific condition. So we have to know that we are responsible using this device, and we have to know how it works, and we have to know how safe it is and what it does. And now this is the task for this afternoon. Okay, Renuvion is a cosmetic technology combining the unique properties of helium plasma with the property of a form of radio frequency energy, an energy which shrinks the tissue. It's a tool for cutting, coagulation, and ablation of soft tissue. And when we look at different kinds of energy, from the ice cube to gas, then we see that we have a different potential of transmitting energy through gas with a very special effect. While we're creating plasma, as you can see here, the energy is transmitted through the air and can easily be distributed to the connective tissue to heat immediately and shrink immediately. In the history of the product, it was called different names, from J-plasma to Renuvion of today. This is due to the fact that the company has developed over time. When you look at the temperature time data points, you see that you have a very quick onset on heat on the connective tissue structures, and you have to imagine that it is like a woof. And in this second, like in 0.04 seconds, there is one coagulation point done. So it's a very fast and very safe procedure. So it will not actually overdo the heating process as contact radio frequency devices will do. And that means the plasma actually is a guiding element that to the lowest specimen of impedance, the energy is directed, and in the minute the coagulation is happen in 0.04 seconds, then the energy jumps to the next fiber and to the next fiber and to the next fiber. It's like a whoosh. Okay, so if you not too quickly use your probe, then you have a solid coagulation with a high specific effect of shrinkage. The optimal temperature for thermal contraction is 85 degrees, as we know. And so if the time for this is short enough, then it is completely safe. And examinations of the as examinations have shown that the heat exposure is very limited and will not increase over 41 degrees, no matter what kind of tumescent solution you're using. It is a heavy solution, or is it a very very poor tumescent solution in the preparation process of pre-tunneling for the probe. Then you will never take the risk of having like an overheated wound, and so we're not considering to have any burns if we use the system correctly. So this is how we can imagine it looks like inside after the liposuction surgery has been performed, and then the Renuvion probe is located subcutaneously, and while we're pushing it forward and backwards in the twin port system, it actually dismisses the energy to the downside of the dermis, as well down to the fascias and the other connective tissue structures. This is the generator, which is specially designed for this Renuvion procedure, and it has it's a bipolar and a monopolar RF generator. As the joule counter is installed, we can actually measure how much energy we will administer in an abdomen or an upper arm or in a neck. So we have a good orientation how the procedure is directed and performed, and what we're actually doing in that tissue. So this is actually the probe, as you can see, has a twin port design. So it has a radial transmission of the energy, which is explained or characterized by the light blue shadow. The single port only directs energy to one direction, so like a semicircle. The handpiece is flexible to some extent, and it has a 3 millimeter diameter shaft, and it has an ergonomic handpiece, and it also has a rubberized grip, and you actually can see the 4 centimeters from the tip to the, so you never actually come too close to the entry point, actually generating energy. So then after a liposuction surgery, we need to pre-tunnel. Then the handpiece are introduced. We have 3 different kinds of handpieces, a twin port and single port, and different length for different kind of indications and different locations where we're using the technique. Now, let's have a look at some examples. The abdomen is, of course, one of the main targets where Renuvion is favorized. And this is the before and after. You see that skin laxity, especially by bending over, is one of the main issues. But for me, in my experience, especially the surface of the skin, depending on what kind of history this patient has, is highly improved using this technique. And this before and after actually demonstrates with the wrinkle above the umbilicus and the reshaping of the umbilicus the potential of that technique. Then another case here by the same surgeon. I just let it let you see and watch it. Another video before and after 7 months. As you can see here, quite a heavy skin laxity, and there's an excellent result on the right side. So this, in my belief, is a combination of a good liposuction, which is a prerequisite, of course, and then the use of Renuvion, which actually has perfectionized this condition. Another case, example number 3, by Larry Fan, 4 weeks post-op, already very good result. The best end result can be expected at the earliest, I believe, at 6 to 7 months. This is what the patient has to know. Sometimes patients come and say after 2 months it got worse. They just have to wait. This is what they need to know. Okay, another case here, very lax, superficially wrinkly skin. Now this is a perfect case for improving the skin condition in this patient, and although the right picture is a bit overblown and has a different lighting than the left one, this is exactly what the quality of Renuvion can do. Neck, of course, is a excellent indication and a desirable indication, since laxity of the jawline as well as the neck angle is the main concern of patients. And then after normal liposuction, there's still after the swelling goes down after 4 to 6 months, then they have some still active gliding plane and excess of skin. Now, in the combination with liposuction surgery and Renuvion, this can be avoided and much more improved, as these pictures are actually demonstrating. Now we have another video. You see the laxity of the skin before and then afterwards. And not only that the laxity has improved, but also the wrinkling is much better. So this is a wonderful case. A man. Men have different necks than women and not so fine. So for this male with this condition, preset condition, this is an excellent result. And some more neck cases as an example, just look at them so you get a feel of what can be done with this technique. Example number 4, quite a heavy neck. And so then the neck angle is not 90 degrees, but for this patient with this precondition is an excellent result, and she's of course very happy. And another one, 40-year-old patient, but it can also be used in elderly patients without any problem. And sometimes you have to wait a little longer for the good results. Here we have an old patient, 60-year-old. So liposuction, then Renuvion used subdermally on the neck, and you see this result. Now this is an excellent result because it's a heavy neck, and it's a wonderful 120-degree neck angle with 100 cc's of fat removed, and then using Renuvion to tighten the skin, additionally to the tightening what the liposuction of course already does by itself. This is remarkable because you see actually a real angle of course a patient is looking for. A patient of 70 years, and there you can see how much in an elderly patient with good skin for this age, it's like a miracle what can happen. Now this is me in the OR working. You see I'm using a powered assisted liposuction device by microair. We're using in the neck a 3 millimeter cannula with a single port Mercedes tip. You can actually see here how it is done. We have totally the jowls here, 5 to 7 entry points. So 5 around the chin and the neck angle, and then 2 at the neck around here is for drainage. And the longer we actually perform the liposuction very carefully, pulling the skin so the cannula is not touching the bone or any risky structures or with a nerval innervation. By pulling the skin, actually we can direct the cannula towards the neck, and then we remove also the subpituitary fat. Now here is the priming of the probe, and then we will see how I have a 15 centimeter handpiece, which is a single port. Yeah. So the energy is directed to the downside of the dermis. I try to reach also the subplatysmal plane, but the energy I apply here is very limited. So we come to thigh cases. Another target area, also again, always in combination with liposuction, because you need the pre-tunneling for the elastic probe of the Renuvion device. And when you pre-tunnel, no matter if you remove a lot of fat or no fat, but you have to pre-tunnel. So it's Renuvion is, in my belief, always a combination with liposuction, but the liposuction procedure. And it doesn't mean that you have to remove fat because it's called liposuction. The liposuction procedure is a method of preparing the subcutaneous plane for the actual procedure of the Renuvion device. Okay, so to make that point clear. Now you see here the before and afters, quite nice result after 5 weeks, much too early for the end result. So if a patient would come after 5 weeks and say it's too, I think it's not really regular in the inner thigh part, I would say wait 6 to 7 months and then we see us again and then we have a look. In most of the cases it's then a wonderful result. Upper arms is, you cannot shrink arms like this with the Renuvion without liposuction, of course. So in this case, ultrasonic liposuction was done, but also the powered assist, as we are using it, would produce the same results. So tightening of this arms is not only due to Renuvion, to make myself very well understood. It is a combination again of liposuction. You have to remove quite a bit of fat and have to injure the different kinds of anatomical planes. So the contraction actually can happen in all levels, and so the redundancy is very well explained. Everyone would believe there's a skin resection, but no, it's a skin shrinkage. And then when you use on top of that the Renuvion device, then you have a refinement, a perfection of the surface, which in most of the liposuction cases alone will not happen. Okay? Another beautiful case here, where you see on the left side the pre-op condition and the after with an excellent retraction. So this is actually wonderfully demonstrating the potential of the technique, especially when you have a correct liposuction surgery, no matter how you do it, with a VASA or with a powered assisted liposuction with the supratumescent technique. For me, the supratumescent technique has the advantage of presenting the subcutaneous anatomy to the cannula. We will talk about that later again. And if you want to have a complete shrinkage and not redundancy by liposuction, then you need to address all the different planes to your cannula. If you use too little tumescence, then the exposure of the complete subcutaneous volumetric area is not approachable by the cannula. So if you use too little tumescence, then there might be anesthesia, but not enough fluid to predictably using the liposuction technique for a global retraction. So again, here a nice case. Example number 3, 70-year-old patient. I believe that the age of the patient really doesn't make a big difference. And one more. Now you have a good impression that quite a bit of fat been removed in a younger patient here, but still, this is the video I have actually contributed to this presentation. Of course, correct positioning, supratumescent, about 3 liters in both arms, 3 to 4 liters, and then you direct your cannula deep to the muscle, and then you work your way up from the deep plane to the more superficial planes. And this will actually give you the opportunity to reach out with the Renuvion part then to have a complete coverage of the whole subcutaneous planes. When a redundancy of the fat of the upper arms exists, then of course the fat is actually gliding above the muscle. So it's the level of the muscle and the fascia which is the most important to work against the skin laxity. Now the Renuvion here is done more superficially here, in that part. And of course, with the twin port, you are able to address in one stroke the superficial and the deeper planes. What you have to take care of is that the flow of helium, if you have no enough exit points, then will escape to the neck and then maybe even into the chest. So you have to take care of this possibility and have enough escape points for the helium gas. Otherwise, the patient will have a Mickey Mouse voice for some time. It's not dangerous. It can compress a little bit the lungs, but there's no danger involved. But just to let you know, you have to be careful to get rid of the helium gas through different access points. Here, repositioning the patient in different positions in order to have a crisscross possibility also for the Renuvion procedure. And this is the last one to see how the shrinkage actually can be imagined. This is a skin flap by from an abdomen, and you see here while introducing the radiofrequency energy, how the flap is melting down and shrinking tremendously. Okay, now this is part number one. There are some references, but this will be also exposed at the booth of the company. So please visit the company booth for further information. So for the discussion and question and answers, I want to introduce to you my dear friend and colleague Christian Stanger, who is also very well trained and experienced with the Renuvion, and he will comment and answer your questions, whatever you have, which is important for you. And we will be back with the pre-recorded live surgery. Thank you very much for your attention.
Okay, thank you for the presentation by Dr. Gerhard Sattler. So now we will proceed to the QA session with Dr. Christian Stanger. Welcome, Dr. Stanger. And okay, there are some questions. So first is about the endpoint. We know many devices, we need to know the endpoint. In this device, we know the relatively safe in very short time, 0.04 seconds, and can reach to the high temperature, 85 degrees Celsius. So how clinically, how can we judge the endpoint in your clinical practice?
So welcome back from the break.
Pardon?
So,
Dr. Stanger?
Yeah.
Okay.
For the question, so I think for sure, like you said, it's difficult, or it's sometimes difficult to say if you applied enough energy. And for me and Dr. Sattler, we discussed this already. I think it's kind of like that you can for sure judge the tissue while making the pinch test, like that you try to elevate the skin, and you can see a direct contraction of the skin after using Renuvion, but you can also feel it when you are moving the probe into the tissue, that the tissue alternates its structure, so it gets a little bit softer to push the probe through the tissue, and while that you can feel that that you kind of like shrink the collagen fibers. So these are two options we are using, and the third one is that we for sure have some ideas how much energy you should deliver to different areas of the body. So Dr. Sattler already mentioned, if you're treating the neck, for sure you need less energy than if you're treating the abdomen or the inner thigh or the upper arm. And for example, for treating an abdomen or the belly region, we normally use around 25 to 30 kilojoules of energy. Or if we are treating the inner thigh, it's because we are treating two sides, it's around the same amount of energy. But if we are treating a neck, so we are talking about perhaps 5 to 8 kilojoules we are applying, or if we are talking about the upper arm, it's around 10 to perhaps 15 kilojoules of energy. So these are only estimates for sure, because you always have to treat every patient individually. So if you have an elder patient, you probably need perhaps a little bit more, or if you have a younger patient, you need a little bit less. If you only want to shrink the skin because you only have skin excess, but there's no laxity of the skin, so you're only applying the subdermal area. If you want to, what Dr. Sattler already mentioned in his talk, if you want to try to connect the gliding planes to fix these, then you have to address different layers of the tissue, and then you probably have to apply more energy. But like I already said in the beginning, it's a combination of kind of like experience, that you can feel how the tissue is alternating whilst the therapy, and also making the pinch test to see the direct alterning of the skin quality.
Yeah, wonderful. You give the guideline about each area, how many energy. May I go to the question further? How
Sure.
can you prevent overdoing?
Yeah. So like you already saw in the video, normally it's not possible to overheat the skin because it won't go over 41 degrees. So we are below the temperature where you could cause burns. But we normally recommend that we move the probe in a specific kind of like speed, and we would recommend that you pull the probe back with a speed of 1 to perhaps 1 centimeter like every second, or 1 to 2 centimeters like every second. That's safe. We never saw any signs of burn. For sure, we use a tumescent technique, so we have the cooling effect of the fluid, and this will also do its job in preventing burns. But like I said, we never had any problems with that. Totally different to using a laser or a radio frequency device. So I think nearly everyone in this talk used also perhaps laser liposuction, and I sadly also caused a burn using that technique once, because if you're moving forward and pushing into the skin, so the probe is so hot with the laser that you can use can make a burn very easily, but never happened that with Renuvion.
Okay, so do you use, for example, the monitor to monitor the skin temperature or not, just clinically?
We did that in the beginning because we are also performing radio frequency, and we always monitor the skin temperature with in these cases. And we did it at the beginning using Renuvion, but we never heated the skin over a temperature of perhaps 38 degrees. So then we stopped it, because also when treating the very thin skin at the neck, or an elderly patient with very thin skin at the upper arms, we never saw temperatures elevating over 38 or perhaps 39 degrees. So we didn't saw any need to do this any further.
Okay. So another question is this procedure always combined with liposuction? Even Dr. Sattler also mentioned sometimes even you not suck out the fat, but you need a pre-tunneling. So if you combine liposuction with the Renuvion, does the downtime become longer or is it almost the same? What's your experience?
Thank you. So I think it's two questions. The first one, yeah, we always kind of like combine liposuction and Renuvion. So if there's nearly no fat we could suck out, then we really use the liposuction without sucking, and just to pre-tunnel the tissue. And in my experience, it's way easier than to push the Renuvion probe through the tissue if you pre-tunneled a little bit. And you have to because the gas has to come out of the tissue. So if you don't do any pre-tunneling, you will only put the gas into the tissue. It won't come out, and this could do problems, or this could cause problems to the patient. That's why we pre-tunnel every time. And the second question, yes, in my experience, the downtime when you combine the liposuction and Renuvion is a little bit longer. So you have to tell your patients that perhaps you talk about 1 or 2 weeks, that the swelling time will be prolonged. A lot of my patients also tell me that the first days after the treatment are a little bit more painful than when only using liposuction. And I think it's because of the energy you delivered. So if you are going down to the fascia and applying energy and heat of 85 degrees, even if it's only a very short amount of time when the energy has contact to the fascia, but it's 85 degrees, so you have a little bit of a coagulation and a wound that you are applying to the fascia, and it's more intense than when only using liposuction. That's a good thing in one point, but on the other point, for sure, the wound is a little bit bigger. I think you can kind of like explain it to yourself. If you're doing an abdominoplasty and you are preparing the fascia and the muscle, then it also makes a little bit more pain to the patient. But I explain this always before performing the treatment, so the patient knows about that. And if you are explaining why you are doing this, so to make a bigger wound in the gliding planes and to shrink the skin, so I think every patient will be fine to accept these little longer downtime. And we are not talking about 2 days in the liposuction and 8 weeks with combining it with Renuvion. It's perhaps like 2 or 3 weeks with liposuction only, and perhaps 1 week longer, or only a couple of days longer when you combine it with Renuvion. So the downtime extension is, I think, not the problem, but the better effect is the thing that is way more important to the patient.
Yeah, so a little bit longer, but we need to explain to the patient before the surgery. So another question is, we know your clinic with Dr. Sattler. What kind of a liposuction system you prefer to use, and why you choose this kind of liposuction system?
So you probably know that Dr. Sattler brought tumescent anesthesia to Germany a long time ago. And he also is very used using the power-assisted liposuction. And that's the system we are using kind of like in perhaps 95% of our liposuctions. But we are also using a radiofrequency assisted liposuction system. And in some cases, it's perhaps a good thing to use this, but mainly we are using power-assisted liposuction. And the reason is that it's very safe, that it's very well known, and that there are good studies that show that we don't do any harm to other tissues like the lymphatic system or the blood vessel system. And I think this is one of the main reasons we're using this technique.
Okay, and another question, this can tighten in the skin. Do you think this can replace some of the facelift surgery or some of the lifting surgical procedure?
Yeah, I think that's a difficult question, to be honest. So until now, we are very careful treating the face with Renuvion internally, because so you have to be careful of any nerval structures that are in the face. So I think for sure it's possible to treat the neck and also the kind of like the line, and perhaps it's also possible if you cover the nerval structures at the mandible very well to treat the lower cheek level. But I'm not sure if it's possible to treat the entire face, like if you are performing a mid-facelift with Renuvion. We never tried it, to be honest, to treat the face, to treat the cheeks until the zygomatic arch. But yeah, so perhaps it could be an option, because the skin shrinkage I see in the neck or in the belly or in the upper arms is very, very, very good. So this would be for sure a very nice minimal invasive technique to perform a kind of facelift. But I'm not 100% sure about the risk of nerval injuries. So that's why we are a little bit cautious treating the face.
Okay, yeah, so the patient safety, especially the preserve the nerve injury, is very important because that's also the facelift surgery is also taking care of this nerve, prevent the nerve damage. So another question is about you do liposuction, Renuvion, and sometimes when you suck out the fat, you may fat injection maybe into the chest or sometimes into the buttock, for example. For this kind of procedure, what's your protocol? For example, you do the liposuction followed by Renuvion, or the liposuction followed by fat injection, and then Renuvion. What's your protocol about this procedure?
If we combine a liposuction with Renuvion and a fat transfer, a fat injection, our protocol normally is that we first perform the liposuction for sure and are gaining the fat implant. Afterwards, we are performing the Renuvion, and at the end point, we are performing the fat injection.
Okay. And another question.
We never treat the same area when we perform Renuvion, and afterwards we don't do fat injection in the area we perform Renuvion in, because Renuvion makes coagulation in the tissue, and so if we want to have the fat transplant to heal in, so we need a very good blood system accept the fat implant. So when you first perform a wound area in some areas, and afterwards you would implant fat, so probably the amount of fat that would grow in would be less. So it's only
okay. Okay, thank you. So it's a very good question. Answer about this. Another, because Renuvion we are calculations of the tissues, so we are not doing the fat transfer for the same area due to the blood supply. So another question is about the patient selection. How can we know the patient is suitable or not suitable for Renuvion procedures? I think the patient selection is very important for many of the procedures to have a successful treatment.
Yeah, so I think we have to divide this question into two. So first, we have kind of like contraindications like in every treatment. So if the patient would have a pacemaker or something like that, so he's not applicable for that treatment. So you always have to think about that. But I think more interesting, because this is a rare condition, is if the skin condition or the amount of skin laxity is possible to treat with Renuvion. So for sure there will be conditions like a massive skin excess that need perhaps a treatment like an abdominoplasty, and so you shouldn't treat patients with so massive skin excess that there is a surgical option needed. But you can, I think, mainly think if you have a certain amount of skin laxity, or if you have a little bit elder patient like in his 50s with a normal body shape that wants to have a liposuction, and for sure his wish is not only to get slimmer but also to have a tighter skin afterwards. So that's the perfect patient to be treated with an additional Renuvion treatment, because there would be a good result while only performing a liposuction, but there will be a better or nearly perfect result while adding Renuvion. And this is, in my eyes, this is the perfect patient. But you always have to be honest with the patient. If there's a skin excess, like if you have lost 50 kilograms or 100 pounds of weight, so this is not the right patient for this treatment.
Okay, so for evaluation, too much skin excess is not a good indication for Renuvion. Another question is about if the patient after one procedure improvement but still have some skin laxity, how long you will do the second procedure?
So we normally recommend that there's a time frame of the minimum of 6 months to perform a new procedure, because wound healing needs time. In the beginning, there will be a fixation of the tissue, and this normally takes up to 3 to 4 months, and then this fixation, because of fibrinogen and all these things happening in the tissue, after 6 months the tissue will get a little bit less sticky. So 6 months will be the minimum, but normally I probably would recommend the patient to wait for 1 year to see the end result after the first treatment, and then you can discuss if another treatment is necessary and what effect the second treatment probably would have.
So, okay, we know minimum 6 months. Usually you will wait until 1 year. But for this question, further question is about the result. Usually you see the result as quick as several months, or what's the onset of the result? What's the maximum of the result?
So I think you have, while you're using Renuvion, you have 2 results, to be honest. So you will have an instant result because of collagen shrinking. So skin shrinkage, because of the heat you applied or the energy you applied, will be kind of like instantly. But there's a second step in this thing, and it's wound healing. And the energy you applied to the tissue will cause a very tight net of wound healing that will happen. And this wound healing, as we know it from performing other treatments like liposuction, or for sure also any kind of laser or energy you deliver to or through the skin, this wound healing needs time, and it needs up to 1 year. So so I normally tell my patients, you will have a very, very early result. This is already good, but it will improve over 1 year because of the second effect the device is delivering, and that is a better and tighter net of wound healing. So skin shrinkage will improve, even if it's good, until you are after 1 year after the treatment.
Okay, I think it's very important because we, as Dr. Stanger mentioned many devices we need this kind of wound healing. We need to wait at least up to a year. Sometimes because this remodeling, the wound healing, it takes time. So we can suggest the patient after Renuvion to wait. Is there any questions? Okay, I see. So, one question is comparison with the phaser liposuction. Use phaser alone will give adequate skin tightening. Have you used in conjunction with phaser and also for extra tightening?
So, because we are not performing basal liposuction, it's difficult for me to answer that question. But
okay.
I know a colleague in another clinic, and he tried it, and he told me that he only made very few cases, but he told me that he also had a better effect of skin shrinkage afterwards. But it's not my own experience.
Okay, thank you for sharing. And another question, do you see some cases, some demarcation with a good contraction area with not very good contraction area?
Yeah, so I think it's a little bit, so the skin shrinkage, that works in kind of like every area, to be honest. In my opinion, it works in every area. For sure, the thinner the skin, the better it works, because you have a better contraction of the loose and thin skin. The reduction of skin laxity, I think it works very well at the abdomen and at the inner thighs and the neck and the upper arms, and it works a little bit less at the back. In my experience, it works a little bit less good at the back, and that's because you have different gliding planes at the back that also are deeper lying, so that the muscles glide over each other, and that makes more gliding in the skin too.
Okay. One of the audience want you explain again the sequence of the liposuction, fat grafting, and the Renuvion.
Yeah, so like I said, so we perform the liposuction and graft the fat, or gain the fat graft. And while the fat is processed, we perform the Renuvion therapy. And at the end point, if we want to transfer fat, for example, in the chest or in the breast or in the buttocks, then we apply the graft, because we directly afterwards want to have a soft compression around the area we transplanted the fat graft to. And if we would perform the treatment with Renuvion after applying the fat graft, so we couldn't perform our slight compression to the area we transplanted the fat graft to. So that's the main reason.
Okay, yeah. So well explained. You needed to have some compressions after the fat graft. Okay. When you're doing the size with liposuction and Renuvion, will you do over the medial and the lateral on the same, or just do one area, and why?
No, so it depends, to be honest. So if we have only need to treat the inner thigh or the medial thigh, we for sure only treat this area. But if there, for example, is also the need of a liposuction at the outer thigh, so we surely treat both areas in one treatment. And I think it's normally possible, because the wound area won't be too big to treat it in one session. And so it's for the patient, it's more comfortable to only have one treatment than to have two. So we normally treat these two areas in one operational procedure.
Okay,
sure,
wonderful. So
Renuvion
usually, combine,
Yeah.
So is there any question from all the participants? Yeah, we if no further question, I think Dr. Stanger, thank you for your time and sharing your experience. We learn a lot from your experience, and thank you. And we will proceed to. Is there any further video of this?
So we have one more video. It's an operation we filmed, and it's Dr. Sattler is performing the operation, and I'm joining him. And we have a very interesting talk while this operation, and we show first a little bit of insight into our liposuction technique, and afterwards how we use Renuvion. So I think it's very interesting for the audience.
Okay, yeah, please.
So we will share this now.
So welcome back from the break, and now we start with the Renuvion pre-recorded operation. Everything was live and is now on tape for you, especially recorded and prepared. It's a 36-year-old male with a previous liposuction surgery and Renuvion procedure where I have administered not enough energy, number one, and I didn't really hit the gliding plane above the muscle. And now when you see the video, you see the condition, which is now the challenge for us to improve. This is our 36-year-old male patient today. He had liposuction a little more than 1 year ago, including Renuvion. At that time, we did not do enough energy, but also when you see the condition 1 year and 3 months post-op, it is still a redundancy of the skin. So the skin itself is not really the problem, except the supra-umbilical area, but it's the gliding of the whole flap above the deeper planes. We call it the gliding plane. So we address today the whole abdomen, upper and lower. We address the superficial fat with the liposuction and later on Renuvion. And then, of course, we start with the deeper plane, the gliding plane, to mobilize and do a powered assisted liposuction. And then afterwards, in that deep plane, we do the Renuvion. Okay? I will discuss with my colleague Christian Stanger about how we do it and what energy we will apply, and also our experience, what we have done and achieved in the past 2 years. The tumescent fluid is there for anesthesia, of course, but more than important is the changing of the consistency of the fat and the tissue by the water. And then we have a secondary, also most important effect, that the hydrodissection, which actually takes place here right at the moment. As you can see, this flap has already raised completely. Now the fluid will go into the gliding plane and it will identify by the lowest resistance for the fluid to penetrate. And therefore, when we go in with our vibrating cannula for the liposuction part of the procedure, then we will be easily identify that gliding plane, as you will have demonstrated shortly. And then we have tunneled for the Renuvion procedure the correct plane for the skin tightening, which actually takes place due to the Renuvion procedure. Nevertheless, of course, the prerequisite for a good Renuvion procedure is the correct liposuction part. If I'm not in the right plane, my Renuvion cannula, which is made out of a special plastic, is not able, like a tunneling cannula of liposuction, to identify the right plane. So in order to prepare the procedure, it needs to be done correctly by the liposuction part. Otherwise, the Renuvion will be not insufficient, but not as good as it can be. Here you see the infiltration speed. This is 200 cc's of fluid per minute, and we have administered 5 liters of fluid. And now we are finished with the infiltration procedure. It took about 30 minutes. We have infiltrated 5 liters of fluid in that marked area. We usually can go up to 10 liters in one case, so we can do much more than what we performed today. Just to let you know, of course, the tight consistency of the tissue here is the guiding line for the wisdom of tumescence, and so we will wait for about 10 to 15 minutes to see if it's still the same type. That will tell us, as the fluid will distribute in the subcutaneous planes, that we have administered enough fluid so we have a supratumescent preparation of the surgical site. Meaning that the fluid will go into the gliding planes, and when we penetrate with our cannula, the liposuction cannula, we will automatically slip into the gliding plane, which, since this is the room of lowest resistance for the fluid, so the fluid will accumulate actually in the gliding plane. Since we have a pre-surgical case in this form, so all the residual fat is covered by scar fibers and will not be very easily approached. But the gliding plane, what we want to actually attack, will be presented by the tumescent preparation. So we're back with the liposuction procedure. As you have seen, we just penetrated the cannula into the tissue, and we direct the cannula immediately more deep in this case in order to detect the gliding plane, and there's practically no resistance. And this will actually offer us then, for the Renuvion part of the procedure, that we will have a good level for the generating the contraction of the skin flap and the adherence to the abdominal wall, of course. You see, I'm not going like this, I'm going deep, and now automatically, due to the pre-tunneling of the hydrodissected fluid, we have a pathway with no resistance. Normally I would not start so deep, but in this case I do. If you would use less tumescent fluid, then the hydrodissection and the hydrodissected pressure in the tissue would not be the same, and then we would not have the same result which we will achieve. In cases of abdomens with even less fat than in our case today, then we of course use the same procedure of liposuction to mobilize and actually treat the gliding planes, where we have for a whole case not more than 50 cc's of fat of aspirate, but we have a complete contraction as a result of that. And using additionally the Renuvion, then we will reinsure even more that we will achieve that goal. So, Christian, You're frowning your head with what I say. So what is your idea when you see how I perform the procedure at the moment?
Yeah, I think it's very important, like you already said, that you're attacking the gliding plane, because the mobility and flexibility of the skin is probably mainly caused by gliding on these planes. So making injury to these will probably already help that in case of wound healing, there will be kind of like a glue into the gliding plane, and it will stick together. And combining it with Renuvion afterwards will improve that effect. So I think it's totally the right plane you are moving in right now. And like you told us before, the patient was treated 1 year ago. So I think it's mainly important to attack the planes that still are sliding on each other, to improve the overall quality of the operation.
So you see, if I'm more superficial, it's hard to actually get through the scar tissue. And you have to be careful and insisting. So you remove a little bit of fat, but it is not really a liposuction as we usually expect.
Yeah, because I also do this, that I perform a second or a third liposuction at the abdomen, and it's always like you're sticking that very tight scar tissue, and you have to be very careful that you don't do any injury to important structures in the skin. So yeah, I totally can feel with you how you can perform this right now.
It's also interesting to observe the difference of the power you actually have to use to penetrate the superficial plane, because there's a resistance, and when I go into the gliding plane, there's no resistance at all.
You can do it with 2 fingers. Yeah, that's right. And normally you always can perform a liposuction in that case, that you only slide very, very easily through the tissue. But the tissue that has been operated before is very, very tight and strong, and it's hard to penetrate. That's right.
When the camera looks at the container, then you will see that there's a lot of fluid and little fat, what we have actually aspirated. This is typical for a secondary case, because the patient actually believes there's still so much fat left, but it's not about the fat anymore, it's about the connective tissue. And since we are dealing and we're targeting more the connective tissue, we are very close to the Renuvion, because the Renuvion is evening out some fibrotic fat lobules, but mainly it's targeting the connective tissue. Definitely. You know? Definitely. So, and now that's when we look about how we, or how I see, hopefully you see it the same way, what is actually the potential of a good Renuvion case. Is it fat melting, or we speak about tightening, but now we do tightening with the normal procedure. If we do the right Tumescent technique, then we speak about tightening of a flap. I believe that it will be a good addition when we do a liposuction case as here. Then it might be even already enough for the, when this is really targeted correctly and pre-tunneled and done in like 3, 4, 5 liposuction passes, not Renuvion passes. The condition might be already so well treated that we don't really need. Of course, when we have it, as now, we will use it. But you don't really need the Renuvion. So where is the actual strong need for the Renuvion? And that is for the superficial smoothing of cellulite, smoothing of scar tissue, where you have indentations due to former procedures or injuries. the naive patient comes and say, I want to look good.
Yeah.
And then, I need to get rid of this, and this.
Yeah.
Once this is done, and they say, now my skin is like a jellyfish.
Yeah.
And when they say, I want to get slim, it automatically means my skin should also be tight.
Yeah, definitely.
So that's what we have to always keep in mind.
Yeah.
Not only shape and silhouette, but also quality of skin is a very important, or the most important issue. And of course, also to be understood when you make an evaluation, what is the most important matter in aesthetics? It's beautiful skin. We're nearly done now with the pre-tunneling liposuction procedure. In this case, I do a little bit the superficial part.
Around the belly.
Yeah, to get also an approach for the more superficial plane, as we have mentioned in the earlier discussion. This was now 15 minutes of lipo, and now the patient actually, since the patient is awake, he will be able to turn a little bit to the side, so we can actually address the hips and the flanks a little bit. And interesting that we still have not very much more fat harvested than we had already in the beginning. So most of the fluid is the water with a little bit of blood. Now we are starting the Renuvion procedure, and by habit I started superficially.
Yeah.
We actually should do deep, so I do this area first and then we go deep.
All right.
And I still feel a lot of resistance of the residual surgery scarring.
Do you also have the experience that if you treat an area with the scar tissue, with Renuvion, that if you treat it for a while, it gets a little bit more soft?
Absolutely.
Yeah.
This is the magic,
Yeah.
because it not only it melts more the scar tissue than the fat.
Definitely.
In the potency of the technique, and this is why it's so amazingly beneficial for secondary liposuction cases, you know.
And to be honest, I don't look at the energy I delivered at the device. So it's more like that I feel that the tissue is getting softer, and when I feel how I can move the device through the skin or through the tissue, then I know I treated the area right. And it's not mainly about, oh, I delivered 3 kilojoule, now I'm ready. But it's more like, okay, I think the tissue here needs a little bit of more energy, and another area it's already softer, so perhaps there's only 2 and there's 3 kilojoules. So
I couldn't even think that to explain it better than you did just now. For me, it's like a hovercraft ship gliding over the water, and now you're actually still battling with the tissue here, and once you're done, it is like a non-resistant gliding through a scar tissue, formerly scar tissue. If you imagine this inside the surgical site, what it means, it's a miracle.
yeah, and for sure, in addition to that, because of collagen fiber shrinking, you also address the tissue in the skin. So you have several layers you're addressing, and because you're using the twin port cannula, so it's kind of like a 360 degrees area of energy you can deliver, and I think that's great, because you have the idea of plasma, and we discussed that before when we didn't record, but you said it's more like there's kind of like a cloud of energy around that device, and everywhere it comes to, you have the effect, and you have the instant shrinkage of collagen fibers, and you have the instant kind of like effect on scar tissue or whatever. And so you can address several layers in just one path, and that's great.
But in the discussion, I'm very happy that we have a collegial interlude.
Yeah.
We both.
Thank you for that. And like you said, if you perform Renuvion at the neck, so you have to be very careful. And I always reduce the flow when I'm treating the neck. So I wouldn't choose 2 liters of flow, perhaps only 1.5 or sometimes only 1 liter. And I reduced the percentage of power. So now we have 75%. At the neck, I probably only use 60 or perhaps 65% of power. So because I'm always a little bit, kind of like a little bit anxious that I don't make any injury to the tissue, and you know there are a lot of dangerous zones there you have to take care of. You don't want to.
In the neck especially, yes.
Yeah, definitely. And so you don't want to make injury to any nerve or vessel or whatever.
Yeah. Now you see here that I'm in the gliding plane and I'm forwarding the cannula with no resistance due to the preparation of the tumescence plus the powered assisted liposuction device.
Yeah, I can see it. It's just like you had no power at all.
Pressure, no resistance, and we have full exposure to the tissue.
And I think you should. What's important to the audience, that you pull the tissue up, that you can slip into this gliding plane. I think that's very interesting for everyone, because if you want to address the deep gliding plane, so you have to elevate the tissue.
Thank you for. I was just trying to speak about it, and you spoke about something else, and I forgot about it. So, yeah, actually raising the tissue makes you automatically slip into the gliding plane. One more thing which came up into my mind is how much energy in a case like this would you administer?
Yeah, so I think I would administer around 20 to 30 kilojoule in an area like that. How about you?
Yeah, this is what I think, and it might be a little bit much for some people, but you have to take into account that with a heavy load of tumescence, it's like a water bath condition for the heat exposure. So you need actually a little bit more energy to compensate the water.
What I want to ask you, Gerhard, are there areas you would be careful to address with Renuvion, or kind of we already discussed about the neck, that you should be kind of like more careful probably about the amount of energy than at the abdomen. But what about perhaps the cheeks or the face? Would you use?
Well, the face, I would be very careful.
Yeah.
Because the tissue of young and older faces, they not compare, and they are individually different. So anything can happen, and I wouldn't take the risk.
Yeah, me too.
Also, I wouldn't take the risk in a pre-surgical neck. And even if it would be 15 years ago that there was a little liposuction, I would not do another treatment. Because with this device we liberate a lot of lymph vessels, and then there will be lymph dripping into a wound, which leads to a completely undesired scarring, which is not beneficial, and I have no good experience with this.
Yeah.
On the other hand, there's not so much where I would not put that
thing into.
Okay,
Yeah.
So.
No, I think I can agree with you about that. So I'm very thankful that you mentioned the pre-operated neck, because it's more like a reflex, you know. So you have a patient, he's coming, he has some sagging at the neck, and he told you, I had a liposuction years ago, and it's not the outcome I want to have. And then you think, oh, I have a great idea, I can use Renuvion to make it more tight. But as you said, if you in some way can make it worse with that. So good to be aware of that.
Let's say in most cases.
Yeah, for sure.
At least from my experience. I don't want to speak for anyone else, but I want to be really careful with this.
Yeah, but
And in the cases which then you actually suffer with the patient, there are no good times, no good
Definitely.
Positive energy,
Yeah.
you know,
No,
and we don't need this.
I think we all should be thankful that we can discuss also things that perhaps don't work out very well. So we only learn from mistakes, and if everything went well, so you always think so everything is great and I'm the biggest guy of all time. So always good to think about what can go wrong. So in one of these cases, so I don't want to have a patient coming after a Renuvion treatment of the neck and he's telling me, so what did you do, my friend? So always.
So the biggest wisdom in aesthetics is to be very calm and controlled.
Yeah.
Do less what you know that you can do instead of being a cowboy doing too much, and then you suffer the consequences. A cosmetic patient has completely different presets in his mind, what he needs from the tender loving care around him and his expectations. So the minute they come in till the minute they go out, and even when they're at home, they still need your attention.
Yeah.
And so anything what you do with them, you in every second you can be can take care of this.
Yeah.
And you're there, and you know, because you know what you've done. And when you do something very risky, you don't know really what happened. Another point to show after a certain amount of time, you have to clean the probe, because the fibers, the charcoal actually
closes the exit point of the helium gas, yeah.
And it makes the transduction from the energy to the skin more difficult, and then there's a gas block.
Yeah, and it's always this sound, we heard it.
F13 is the warning.
Yeah.
Does not work.
Doesn't work, yeah. But now, as you clean it, everything will work fine again.
So that's what we will prove. What are your final remarks? What do you think?
Yeah, I think, like we already discussed, performing a good liposuction or a perfect liposuction in a very good tumescent anesthesia, that's the main key point to mobilize the skin and to make it possible to address the right planes. Mm-hmm. And adding Renuvion will lift it on another level, because you can harmonize the skin, you can have shrinkage of the skin due to collagen shrinking in the subdermal area, and it's an on-top treatment to kind of like fix the gliding planes together that you already addressed with the liposuction. And for sure you made some wound area there, but to make this wound area bigger and more harmonized, I think that's a great thing.
Final question. Do I really need Renuvion? As a question, right? So, and when you look at how this case has developed, do you think this would be possible without Renuvion?
No. To be honest, I don't think it's possible without.
When you see how this scar tissue, big strings of scarred fibrous tissue gathering a load of fat in that bulge here and here, we would have never had the possibility to attack this.
Definitely not.
And this makes everyone in the audience aware that this is, if you treat a case like this, like secondary, you automatically, when you're an experienced aesthetic body physician and you're a center, you need to have this, because otherwise you're not able to really lift the complete potential, and you're not competitive to your colleagues who are well trained with this technique.
You're totally right.
So I hope you had you enjoyed the video. It was a little bit longer because it already has included some discussion which we had while we did the surgery with Christian, and it was a lot of fun for us too. So I just want to focus to two little things again. it's very important to have the possibility to approach all the different anatomical levels in order to place the energy in these levels. So then you have complete retraction. And the abdominal wall is a very good example because you have so many different levels which you have to address. Now, in the sketch which I have prepared to explain horizontal shifting, all these levels from the abdominal wall has a lateral shifting capacity. And the total shifting capacity is the summation of these levels of anatomy added together. But then the biggest part is actually the flexicity of that skin flap over the gliding plane of the muscle. So the gliding plane potential plus all the individual subcutaneous levels, lateral shifting capacity gives us the total horizontal shifting capacity. Now, why do I say this on and on and on again? Because in former times, mostly plastic surgeons look at a skin flap and say, the skin is old and it cannot retract, so we have to make an abdominoplasty. Not knowing, because in plastic surgery, supratumescent technique is not really a general technique. They don't know that above the abdominal wall and the abdominal fascia, there is a room which we call the gliding plane. And if you address with your technique, liposuction and Renuvion, you can have a complete contraction and rehabilitation of that gliding plane as in a younger individual of 25 years. So after healing, this is compact and will not move again. So, and then secondarily, the skin as a reactive organ will attach and react and then will shrink over time and then will be tight. Now this information I wanted to share with you. Thank you for your attention. And now there's the question and answers again with Christian.
Yeah, wonderful live surgery video. And also in this video, mention many of the important point. For example, the gliding plane above the muscles. And I think that this kind of tightening is not only tightening the skin, it's tightening different layers, tightening the skin and tightening the tissues. So it's all together to make this clinical result. So may I ask Stanger? So in your video procedures, so you use supertumescent, and you put the supertumescent over the more superficial of fat, and make the waiting 10 to 15 minutes to make this tumescent going down to the deep plane, to the gliding plane. Is that right, or it's vice versa?
Yeah, so we try to address all layers of fat with the tumescent solution. But for sure, as you said, while waiting for some time, the fluid will also kind of like flow down to other planes, because there are connections between these levels. So the first thing for sure is to try to get this fluid in all areas, but like the effect of waiting is that it gets in all the areas very equally, and then it kind of like divides the layers, and it's easier, like Dr. Sattler explained, to address the right plane with the liposuction cannula. And we normally wait not only for perhaps 15 minutes, we normally wait up to 30 minutes, 45 minutes. It depends on the case. In this case, we perhaps waited for, to be honest, I think also 30 minutes. He said it's up to 10 to 15, but we normally wait much longer because the fluid needs more time, and the effect of the fluid gets better if you wait longer. For sure, because this fluid is also containing adrenaline, you shouldn't wait too long, because if you would do so, there would be for sure some absorption of these ingredients, and you don't want to have that, because your patient could get a little bit have an effect of the adrenaline in the solution, like tachycardia or things like that. So don't wait longer than perhaps 1 hour, but up to 1 hour is safe. We make this every day.
Okay, I think so. In this video, you also shows a very important maneuver. Use your non-dominant hand to pinch, pull the tissue up, so you can check the right plane, the gliding plane. Is that right? The deep plane of the gliding plane.
Yeah, that's totally correct. Thank you.
Yeah, and also, yeah, please.
No, thank you for mentioning that. It's very important to raise the skin or to elevate the tissue to address the right plane. And like I told you in the last question and answer, for sure it also gives you some information when you do this with the Renuvion probe, that you can also feel how the tissue already alternates while applying energy. So it's two things in one.
I think this video also gives us very important information about the neck. Also, we have pre-procedures, pre-operation, previous operation neck cases, we should be very careful. And for the Renuvion, now in this video, you do Dr. Gerhard do the superficial first and then do the deeper of the Renuvion. Is that right?
Yeah. So I normally do it in the other way, to be honest. So I normally first attack the deeper gliding planes to fix kind of like the tissue on the muscle fascia. And afterwards, I treat the superficial planes. But in this case, he did it because it was a patient that has been, where a liposuction has been performed before. So we had scar tissue in the umbilical area, and he tried to soften that scar tissue and to harmonize the skin while using Renuvion. And for sure, I think this is not the main idea of using Renuvion. So normally we talk about skin shrinkage or collagen fiber shrinkage. And for sure, we also talk about fixation of skin in gliding planes or on muscle fascias. But to be honest, using that technique is also very, very powerful to harmonize scar tissue. Because you know, or everyone knows, that the scar tissue is kind of like a very uncommon structure of collagen fibers that are produced by the body while healing a wound. And if you shrink all these fibers, the net that is kind of like produced by these collagen fibers in scar healing or in scar tissue, these get a little bit more divided, so the scar tissue gets softer. So this is very interesting. You can use it in kind of like every area where you have a scarring to improve that scar. And I used it not only in cases of second liposuction, where you have scar because of scar tissue because of the first liposuction. You can also use it to harmonize scars after a cesarean section. If you have women that have had a cesarean section and you perform a liposuction, for sure you also pre-tunnel this area while performing the liposuction. But when you add Renuvion to this area, it very softens that scar, and it's more even in the skin afterwards.
Thank you. It's a very important information. It also can improve the scar over the area And also, I think this case is a very good case. If you only do the liposuction, you will not satisfy this case because it's too much laxity all over the skin and over the gliding plane. So in this case, we cannot only do the liposuction as we saw in the video, not too much fat aspirate from this procedure, but we need to tightening the skin, tightening the whole tissues. That's key of success for this kind of cases. Yeah, and yeah, thank you. And is there any further question from all the audience? Interval. Okay. One question: what's the interval of fat grafting follow the Renuvion?
Sorry.
What's the interval of fat grafting following Renuvion? For example, 3 months, or what's your principle?
So I'll be honest. So I usually prefer grafting the fat when it's still alive. So I normally gain a fat transplant, and then I do the transplantation right afterwards. Because if you store it, like I know that some people are putting it into the -80 degrees freezer, and then they are grafting it after 3 months or 6 months. But you always have to be aware that now you kind of like only graft the dead tissue, and it's kind of like a filler for sure, but it will be in the most of that fat will be go away after some time. So I normally prefer grafting a living fat transplant, and that's why I normally do it directly after gaining that graft. But if I misunderstood the question, if you want to treat kind of like two different things, that you treated an area with Renuvion and then want to graft fresh fat into that area that you gain from another area of the body, then I would recommend not to wait 3 but better 6 months, because after 3 months you probably are in a time shift of wound healing, and I think the exception of the graft will be less good than if you wait a little bit longer.
And okay, I think that maybe the last question. For clinically, how many passes you will do in one area? Passes,
Yeah,
or
so,
you just
so in the beginning, we were told when we were new with using Renuvion, we were told that we have to kind of like do every tunnel with 5 passes, and then do the next and do the next, and that you should use a speed of perhaps 1 centimeter per second to pull the probe out. But after some time, when we get more used to the treatment with Renuvion, we kind of like alternated the treatment a little bit, and it's that we, like Dr. Sattler said in the video, we more try to make a crisscross, that we are making overlapping treatments of the same area. Because if you only use kind of like 1 entry point, and perhaps you are performing 5 tunnels like my hand, then you probably you for sure can treat this area 5 times and this, but what about the spaces in between these tunnels you are using with the device? So if you are if you are applying 2 layers or perhaps 3 or 4, then the net of energy you are delivering will be much more even. So I think it's not so much about how many passes you definitely use in 1 tunnel. It's more about that you deliver a lot of energy over the whole area, because this will make the harmonization effect of the skin if you treat the subdermal layer. and the shrinkage of collagen and the shrinkage of skin. And this will also make the better fixation of the skin flap on the muscle fascia when you attack the gliding plane. So it's more about I think the total amount of energy, I mentioned this before, in some areas, and not about how many passes you apply to one tunnel. But if you ask that, then I would recommend make 3 or 4 passes in one tunnel, but do a crisscross.
Okay, so it's, thanks a lot for this experience sharing. 3 or 4 and make a quick cross, so it may more even distribution and have a better result. Yeah, thank you. With that, I think that we thanks a lot for Dr. Christian Stanger and Dr. Gerhard Sattler for the wonderful webinar and share their experience about the liposuction and the Renuvion. And we know in selected cases like the life surgery cases, we do need to use combined liposuction and this kind of tightening device to get the best result. So thank you once again, and thank you all the doctor participants to this webinar. Is there, if not, no further question, I would like to please everyone, thank you, Dr. Stanger and Dr. Gerhard Sattler. Thank you.
I'd like to thank Dr. Peng for hosting this. Thank you very much. And I'd like to thank TBMS for organizing it. And I too would like to thank Dr. Sattler and Dr. Stanger for their presentations. It's been a very interesting and enlightening webinar. Thank you very much.